Good day, everyone. You're welcome to my YouTube channel, Everything Medical. In today's video, we shall be appreciating the thoracic spine, that is the thoracic vertebra. If you are coming across to my channel in your first time, remember to subscribe, like, comment, and also share our video so that other students will see the channel and also benefit from our videos. Now, let's delve into this compassionate bony structure. The first thing you should note about this bony structure that it is unique among other vertebra because of numerous articular facets that it has. Now, the thoracic vertebra is the second segment of the vertebral column. This is the second segment of the vertebral column because the cervical vertebra is the first segment. So the thoracic vertebra is the second segment of the vertebral column that is located between the cervical vertebra and the lumbar vertebra. That is where it is located. It is 12 in number. That is, we have 12 thoracic vertebra among the 3 vertebrae we have in the human body. These thoracic vertebra, alongside with the rib and the sternum, forms the osteocartilaginous skeleton of the thorax, which is called the thoracic cage. Yes, it participates in the formation of the thoracic cage, where it forms the posterior boundary of the thoracic cage. And since it participates in the formation of the skeleton of the thoracic cage, that means it protects the compassionate thoracic viscera, such as the heart, the lungs, and the esophagus, right? So to tell you that this bone is so much essential. Now, we shall be discussing the significant characteristic features of this bone among other vertebrae. What are those distinguishing features that it has among other vertebrae? Now, you can see this bone that it is so compassionate, right? The first feature it has that is so distinguishing from other vertebrae is that it has a vertebral body that is heart in shape. You can see this is a vertebral body. Here is the vertebral body, right? This is the vertebral body. It is heart in shape. The next feature that it has is the demi-facet, which is the superior costal facet and inferior costal facet on the both sides of the vertebral body. Now, you can see this is a superior facet, this is inferior facet. This is superior facet, also this is inferior facet. So two of them are called the superior and inferior costal facet. Before I proceed further, you have to understand that there are numerous facets on this bone. So any facet that bears costal, it means that it has an articulation with the rib, either on the head of the rib or at the tubercle of the rib. Whereas any of the facet that does not bear costal, meaning that it does not form any articulation with the rib, right? Because costal is a Latin word which means rib, right? So it has a demi-facet which is comprised of the superior and inferior costal facet, superior and inferior costal facet, which usually articulate with the head of the corresponding rib, right? That means the superior articular facet will articulate with the superior rib. Inferior articular facet or inferior costal facet will articulate with the inferior rib, right? So it is found on the both sides of the vertebral body. You can see here on the both sides of the vertebral body. The next feature it has is the spinous process. You can see that this is the spine, right? Here is the lamina, right? So the spinous process is a long bony projection which is usually projected slantly inferiorly. You can see that it is slantly inferiorly, right? It is not superior. And this is the normal way to position it. It's not this way, right? If you place it this way, you discover that it is slightly inferiorly. Slanty is not straight, it is slanty, as if it's diagonal, right? So this is another feature that is distinguishing from other vertebrae. The fourth feature it has is the transverse costal facet. Now, the transverse costal facet is found on the both side of the transverse process. Look at the both side of the transverse process. This is the transverse costal facet of this transverse process. Why this is also the transverse costal facet of this transverse process, right? Now, what is the work of this facet? This both side of the transverse costal facet forms an articulation with the tubercle of the ribs, with the tubercle of the corresponding rib. That means any rib that attaches on this or articulates on this superior costal facet, each tubercle will articulate on this transverse costal facet. But this articulation is mainly by the typical thoracic vertebra, because the vertebra is very into two. We have the typical and atypical. The typical is ranging from the T2 to T9, while T1, T10, T11, and T12 are the typical thoracic vertebra, right? Now, that means the typical thoracic vertebra has complete facet. That is from T2 to T9. Whereas those that forms its atypical thoracic vertebra, which is ranging from T1, T10, T11, and T12, does not have a complete facet, right? As you proceed, you get to know more features about it. So those are the four features it has that is distinguishing from other vertebrae. You have the vertebral body that is heart-shaped. We have the mid-facet, which is the superior and inferior costal facet. We have the transverse costal facet that is found on the both sides of the transverse process. We have the spinous process. So recall that this spinous process usually protects the spinal cord, maybe from injury, such as injury with knife, right? And that is how it works. Did you get? And that is how it works. Now, the next feature we shall be looking on to is the ligament, right? The ligament. But before we dive into that, let's quickly look into other facets. Now, this facet here that you are seeing here is the superior articular facet. This is the inferior articular facet. Why is it that it's bearing like it does not have costal? Because it does not form any articulation with the rib. So this superior articular facet articulates with the corresponding vertebra, right? Because another vertebra usually fits in here with the help of the intervening intervertebral disc, which is a fibrocartilaginous structure, right? And that is why it is being classified under cartilaginous joint called the symphysis, right? It's a joint that holds the corresponding vertebra in order to articulate on this superior articular facet with its inferior articular facet of the corresponding vertebra or the adjacent vertebra. Now, this inferior articular facet articulates with the next thoracic vertebra on its superior articular facet. So that is how it works, right? So there is no rib here. There is no rib, does not attach or articulate on this articular facet. It is mainly by the corresponding thoracic vertebra, right? And you have to understand that the intervening intervertebral disc usually join the corresponding vertebrae. That is the entire length of the vertebra. It is not only the thoracic vertebra, right? Now, let's quickly look into the ligament. The ligament of the thoracic vertebra is divided into two. One is the ligament that is found throughout the entire length of the vertebra. The number 2 is the ligament that is unique for the thoracic vertebra. So we shall be starting with the one that is found throughout the entire length of the thoracic vertebra, right? The number 1 ligament is the anterior and posterior longitudinal ligament. These ligaments are those ligaments that is found throughout the entire length of the vertebral column, right? It is not peculiar for thoracic vertebra. So we have the anterior and posterior longitudinal ligament. It is a ligament that is found throughout the entire length of the vertebral column, which covers the vertebral body and also the vertebral arch. It covers the vertebral body and also the intervening intervertebral disc alongside with other structures. The next ligament, which is the second, is the ligamentum flavum. This ligamentum flavum usually connects the lamina. This lamina, here is the lamina. It connects the lamina of the thoracic vertebra with the adjacent vertebra. The next ligament, which is the third one, is the interspinous ligament. The interspinous ligament. This interspinous ligament is a ligament which connects the spinous process of the thoracic vertebra with the adjacent rib. The next ligament, which is the fourth one, is the supraspinous ligament. This supraspinous ligament is a ligament which connects the tip of the spinous process of thoracic vertebra alongside with the adjacent vertebra, right? So those are the 4 ligaments that is found throughout the entire length of the vertebral column. Now let's quickly look into the ligament that is unique for the thoracic vertebra. We have number 1, the radiate ligament of the head of the rib. The radiate ligament of the head of the rib, right? That is number 1. The next ligament is the costotransverse ligament. The costotransverse ligament, right? The second and the third ligament is the lateral costotransverse ligament, while the fourth ligament is the superior costotransverse ligament. So these are the 4 ligaments that is peculiar for the thoracic vertebra. Why the previous ligament I mentioned are the ligament that is found throughout the entire length of the vertebral column, right? Now let's quickly look into the joints of the thoracic vertebra. The joint of the thoracic vertebra. Now the joint of this bony structure is divided into 2. It is divided into 2, right? It is divided into 2. It is similar to what we discussed as its division on the ligament. So we have two categories of this joint. The number 1 is the joint that is found throughout the entire length of the thoracic of the vertebral column, while the number 2 is the joint that is found peculiarly and unique for the thoracic vertebra. Now we shall be starting with the joint that is found throughout the entire length of the thoracic of the vertebral column, please, not the thoracic. Number 1 is the joint between the vertebral body, while the number 2 is the joint between the vertebral arch or arc, right? Now, the joints between the vertebral bodies are those joints that connect to adjacent vertebra. It connects to adjacent vertebra, which is known as the intervening intervertebral disc. Now, watch. That joint is usually here. It is made up of fibrocartilage, right? And that is why it belongs to a cartilaginous joint called the symphysis. I've said it previously, right? So the intervening intervertebral disc is a joint that connects the adjacent vertebral bodies together. It is found on this region, on this manner, and it is also found here. That means it connects the superior placed vertebra and also connect the inferior placed vertebra. So the joint is called the intervening intervertebral disc, right? It is made up of a fibrocartilage. That is why it is classified under cartilaginous joint called the symphysis, right? The next joint is the joint that is found between the vertebral arc, right? It's found between the vertebral arc. And this joint is formed by the superior and inferior articular processes of the adjacent vertebra, right? It is a synovial joint type, right? So that is how it works. Now, let's quickly look into the joint that is unique for the thoracic vertebra. We have two types of joints that is unique for thoracic vertebra. We have the costal vertebra joint. The costal vertebra joint, you should understand that costal vertebra is a compound word, right? So costal is rib, vertebra is the vertebra bone, right? Now, the costal vertebra joint is a joint that is formed by the inferior and superior costal facet of the vertebral bone, that is the thoracic vertebra, and also the head of the rib. So this superior costal facet and inferior costal facet that is found on the both sides of the vertebral body forms the costal vertebra joint. While the costal transverse joint is formed by the transverse articular facet that is found on the both transverse process and also the tubercle of the adjacent rib or the corresponding rib, right? So this is the facet where it articulates. That is the transverse articular facet or the transverse costal facet per se, because it bears the rib. So the costal should be there, the transverse costal facet, right? So there are two joints here. One is the costal vertebral joint. Two is the costal transverse joint. Recall that here is the pedicle, right? This is the pedicle that is here. While here is the inferior vertebral notch. This is the inferior vertebral notch that is found on the both sides. Inferior vertebral notch. Here is the spinal canal or the spinal cord, the spinal canal, which is being protected by this slantly inferiorly bony process per se, which is called the spinous process. It protects the spinal cord from trauma or traumatic injury, mainly by knife or other sharp object, right? So those are the joints of the thoracic vertebra. Let's quickly look into the clinical correlation of the thoracic vertebra. We have number one is the thoracic kyphosis. Thoracic kyphosis. When we talk about thoracic kyphosis, we refer to the bony deformity of the thoracic vertebra. We call it the thoracic kyphosis. It is a condition whereby there is an excessive curvature of the thoracic spine. When it is curved, you are seeing my screen, there's a picture there. You can see how it presents, right? It presents like a hunchback. That is how it works. And it is mostly occurs as a result of osteoporosis of bone, whereby the bone loses its mass. It becomes too soft and becomes too easy to bend, right? It's no longer strong anymore. So the bone has lost its mass, whereby it can be susceptible to injury, right? So osteoporosis is one of its cause that leads to thoracic kyphosis, whereby there's an excessive curvature of the thoracic spine, whereby it presents clinically hunchback, right? And it can occur in all gender. So I believe you really enjoyed this video. Thank you so much for staying to the end. I really appreciate.